This PowerPoint is an overview of a research study on the short-term effectiveness of the Diabetes Empowerment Education Program, otherwise known as DEEP, by Concord University graduate student Latasha Saunders. There are 4 types of diabetes. Type 1 diabetes is autoimmune and occurs when the body has an inability to produce insulin. Type 2 diabetes occurs when the body makes insufficient insulin or when the body is unable to use the insulin that it is producing. Prediabetes is a diagnosis when blood sugar levels are higher than normal but not yet high enough to be classified as type 2 diabetes. And without intervention, prediabetes is likely to become type 2 diabetes in 10 years or less. And gestational diabetes occurs in pregnant women. Some facts about diabetes. It is the 6th leading cause of death in the United States. Diabetes is chronic, but type 2 and prediabetes are preventable. Almost 30 million people in the United States are diagnosed with the disease. Over 6 million people remain undiagnosed in the United States. And the West Virginia Department of Health and Human Resources reported in 2011 that diabetes was the cause of death for 3.8% of males and 3.4% of females in West Virginia. The agency where I work and I am currently placed for my field placement is Southern West Virginia Health Systems. It is a company of Lincoln Primary Care Center, and we serve, our site actually serves 3 counties, Boone, Lincoln, and Kanawha. And of those counties, Boone County has 2,720 people diagnosed with diabetes. A little bit about the Diabetes Empowerment Education Program. The DEEP curriculum aids participants in reducing their risk of obesity, hypertension, cardiovascular disease, stroke, and psychological issues that can coincide with the disease. The program focuses on participant empowerment and self-management skills. Empowerment in this context allows participants to be in charge of their health and make behavioral changes to encourage healthier choices. It was developed at the University of Illinois at Chicago, initially for Latin Americans, and it's currently being implemented in 4 countries and in 12 states. The goals are to reduce diabetes disparities among minorities in the United States and to prevent and or reduce. Some more information about DEEP. It is a 6-week evidence-based program. It includes 8 modules with information about diabetes risk factors, understanding of the human body and diabetes complications, how to monitor your body and understand the numbers, diabetes medications, meal planning, physical activity, and lastly, living with diabetes and the emotional aspects. This information is given in very short lectures with visual aids, meaning that it is not delivered over PowerPoint. It is delivered either on a marker board or on flip charts. There are a lot of hands-on activities in every session. Participants are encouraged to participate openly, and there are action plans given at the end of every session. The research question for this project is as follows. Does implementation of the DEEP program increase participant understanding, coping, and management of? In this next section, I will briefly describe the methods of the research, including participant and procedure information. Participants were randomly selected from Southern West Virginia Health Systems who were diagnosed with, God damn it, you've like, some more information about participants. Some general information. There were 8 Lincoln County participants and 6 Kanawha County participants. The age of the participants ranged from 41 to 81 years old. There were 9 male and 5 female participants, and education levels varied from 11 high school diplomas, 2 college graduates, and 1 with an 8th grade education. In diabetes status, we had 2 pre-diabetics, 10 type 2 diabetics, and 2 people who were caregivers of type 2 diabetics. Okay, procedure. This research was a single-subject quasi-experimental ABA design. The A baseline was participant understanding before DEEP implementation. The intervention, or B, was the DEEP curriculum, and the A baseline was then measured again after the DEEP implementation was over. The dependent variable was the participant understanding of diabetes, and the independent variable was the curriculum, the Diabetes Empowerment Education Program. Measurement tools that were used. I used a pre and post test, consisted of 14 questions. 4 questions were regarding understanding of the disease, 5 questions about the stress and coping with the disease, and then the last 5 questions was an individualized rating scale for self-management of the past 7 days. Instructor evaluations were also handed out at the end of every session. These are already a part of the DEEP curriculum, and they were used solely for the purposes of the educator to kind of gauge their teaching methods and communication of the material. The next few slides reveal the results of the study and compare the answers to the pre and post test. Of the 14 participants who initially started the research, only 8 completed both tests. The answers displayed in the next section reflect only those 8 participants. This table breaks down the first 4 questions about participants' understanding of diabetes. The first question, how does exercise help your blood sugar? There were 2 people to answer the question correctly with that it lowers blood sugar. And then after DEEP implementation, there were 7 people who were able to answer that correctly. So 5 people actually improved and were able to understand the material and answer that question correctly. The next question, which is the best way to take care of your feet? The correct answer was to look at them and wash them every day. During the pre-test, 5 people answered correctly, and the post-test, 8 people answered correctly. So that implementation influenced 3 people in a positive manner. The next question, what is a retinal exam? And that is an exam of your eyes, and 6 people were able to answer that correctly before implementation of DEEP. Then after, 8 people were able to answer correctly with, a +2 difference after implementation. And the last question for understanding diabetes was carbohydrates break down in your body to what? And the answer to that is sugar. 3 were able to answer correctly before DEEP implementation, and then 6 were able to answer correctly after. So the material and the education that was received during DEEP did positively affect the participants' answers in all aspects of understanding diabetes. This next chart is about the coping with diabetes section of the pre and post test. The first question, how often in the last week have you felt overwhelmed by living with diabetes? And participants were given the answers never, almost never, sometimes, most of the time, and always. Most participants selected always. 5 out of the 8 participants selected always in the pre-test. And then for the post-test, most of the participants selected sometimes. So there was a gradual improvement over the pre-test and post-test after DEEP implementation. The always answer went from 5 to 1, so it had a decrease of 4 participants. One of those participants still felt overwhelmed by living with diabetes. The next question, do you know of healthy ways to handle the stress related to your diabetes? They were given the answers yes, maybe, I don't know, I don't think so, and no. Before deep implementation and the pretest, 5 out of the 8 participants said no. They did not know healthy ways to handle the stress. After deep implementation, those 5 participants indicated that maybe they would be able to. And we actually had 3 participants who were able to say yes, they definitely knew how to handle the stress that was related to their diabetes, compared to no participants selecting that in the pretest. The next question, do you feel you can ask for support on how to live with and take care of your diabetes? With the same answers, yes, maybe, I don't know, I don't think so, and no. During the pretest, the most people answered with I don't think so. And then maybe and I don't know were even, and only one person was able to say yes, they could ask for support. In the post-test, that one yes increased to 3. So 2 more people in addition to that one were able to feel confident in asking for support to help take care of their diabetes. Do you feel you can ask your doctor questions about your treatment? Presented with the same answers, yes, maybe, don't know, I don't think so, and no. In the pretest, only one person said yes, they could ask their doctor. And then the post-test, actually all 8 participants said that they felt comfortable in asking their doctor about their treatment plans. So overall, there was a positive effect on the coping with diabetes. And the self-management rating scale, I know that this chart is difficult to read, but I'll try to go over it as best as I can. This self-management rating scale was over a 7-day period, and participants were to judge how many days they did a certain activity. So the first question, how many days did you eat 5 or more servings of fruit and vegetables? The pretest, 2 people said no days, and 2 other people said 5 days, and there were some ones there in between. In the post-test, we had no participants say that they didn't eat any servings. And then 2 participants said they ate those servings 4 out of the 7 days and 6 out of the 7 days, which is a very good improvement. How many days did you exercise? At least 30 minutes. In the pretest, 6 out of the 8 participants said 0 days. They did not exercise whatsoever. And then after the post-test, during the post-test and after implementation, only 3 said they didn't exercise at all. These answers here, after getting in the discussion during that session, some participants believed that you had to be physically able to exercise, so you had to be able to get up and run or go to the gym or do some kind of aerobic class. And after, the educator explained, there are activities that you can do sitting down or laying down, then their concept, their ideas of exercise did change. So those answers could be skewed because they weren't aware that you can exercise actually sitting down. How many days did you check your blood sugar? For this, it was pretty much even. We had one participant who was a pre-diabetic and did not have to test their blood sugar, so there was no change there. After the post-test though, all participants, with the exception of that pre-diabetic, did test their blood sugar every day. The last question, how many days did you check your feet? Before deep implementation, 4 people said 0 days. And after implementation for the post-test results, 0 people said that. So, and looking at the other results, only 2 people checked them every single day. 1 person continued to check them before and after implementation 5 days a week. 4 days a week went up 1. 3 days a week decreased. So one of those people who indicated that they check their feet 3 days a week in the post-test could have moved up in saying that they check their feet 4, 5, or 7 days. So overall, with the self-management rating scale, participants did increase their behaviors and they made better choices in regards to their diabetes. Limitations and implications. Some limitations to the study. The first one is time. There was not enough time to test the long-term effects. Initially, I wanted to record their A1C levels and their weight, and then record those after DEEP implementation. The A1C levels are only taken every 3 months, so the time constraints for this research project just were not doable for that. But that is something that people could do for future studies with things like this, is be able to monitor maybe every 3 months and then 6 months and up to a year. That would show some long-term effects of the educational program. And also, this was the second time that this class was held at our agency. The first time I was still in training, so I didn't actually conduct that one. But we did that class at 2 o'clock in the afternoon, and this class was done at 10 o'clock in the morning. So that could have affected participation. Also, there was a lack of control group for this. We didn't have a group of people who didn't receive any kind of education to compare the ones who did receive that education. So having a control group for an experiment like this could definitely strengthen the results. Okay, the implications. The results appear to uphold the hypothesis that diabetes education, which is the DEEP program, increases patient understanding, coping, and self-management of the disease. DEEP is a short-term educational program that is evidence-based. Completing research like this strengthens the evidence that it is effective in persons with diabetes. This program is also written on a 6th grade educational level, and education is a deficit in rural areas, so this is an ideal program for people that we serve. And being more knowledgeable about our health and treatment allow for better self-management and possible prevention of complications of the disease. Here is a list of references that I've used, both in my research project and for this PowerPoint, but these 4 references coincide with the information that has been reflected in the PowerPoint. So this concludes my presentation, and I just want to thank everybody for watching, and also a special shout out to Ashley Harvey for providing the instructions on making this PowerPoint, because without her I wouldn't have been able to make this happen. So thanks again for viewing my project, and I look forward to seeing you all next semester. Thanks.